But what is most important po is on the right. On the right, you see the hospitalizations in South Africa. And what you see is, despite the accelerating numbers of cases of Omicron, the hospitalizations are on track and are not rising faster, very similar to the other waves of the variants in South Africa. Next slide, please. This is the preliminary data that was published on Saturday po. What we're looking at here now is the relative risk persons. So on this graph, if you were 100%, if the red line was 100%, on this graph, if you were 100%, if the red line was 100%, then the risk is comparable between an unvaccinated and a vaccinated Filipino. What you can see is that the Delta wave had a 9% relative risk, and we can see that the Omicron wave is 3 times higher than the Delta wave. So it is true that the preliminary data coming from South Africa suggests that the Omicron variant is more transmissible amongst vaccinated individuals. Next slide, please. But it is really important to focus on hospitalization spots. So if you look at the hospitalizations, this is a screen grab from a presentation from the Department of Health in South Africa, from the province of Gauteng, which is the hotspot for the Omicron explosion that is currently taking place. What you can see is that the preliminary data suggests that 10 times more unvaccinated individuals are being hospitalized as compared to vaccinated individuals. This is incredibly hopeful, especially since, as I highlighted before, because of the NCR plus 8 strategy, our cities and first-class municipalities, which is the target for Omicron when it arrives in the Philippines, are highly vaccinated. Next slide, please. This is data from the Shuain district of South Africa from 3 days ago po. So this is the most recent data that we can get on the Omicron. Next slide, please. What you can see from a few days ago is that this district in South Africa is experiencing a dramatic surge of COVID-19. They're experiencing 3,000 cases per day on the 3rd of December. On the right, you see that many of the hospitalizations are still are of people 50 years and below. Next slide, please. Despite the number of COVID-19 positives, however, the Omicron hospitalizations are quite low. So you have only something to the effect of 42 to 29 hospitalizations, despite the thousands of individuals who are testing positive for COVID-19. Next slide, please. What is important is that if you look at the numbers of the people who were hospitalized, what is so amazing about the Omicron is that 70% of them do not need oxygen po. And this is very different from the Delta experience that we experienced throughout the world and in the last few months in the Philippines. So we have 31% require oxygen, 70% do not require oxygen. Next slide, please. And what is striking is that 10 of the 11 people who needed oxygen were unvaccinated. And again, what this suggests is that if you are vaccinated, this will protect you against severe disease and hospitalizations even with Omicron, which is good news for us. Next slide, please. So there are 3 important questions that the scientists of the world are waiting for. Is the Omicron variant more transmissible? It is likely po that it is more transmissible. Is the Omicron variant more immune evasive? Probably po. The initial data seems to look like that. Is the Omicron variant more deadly? And this is the good news po. It's probably less deadly than Delta. I have to point out po that this is preliminary data and we are waiting for data from the older populations in the global north because there are not many lolos and lolas in South Africa. And so most of the patients that we are seeing in the hospitals of South Africa are relatively young. We still do not know po what will happen when when Omicron begins to spread in the northern part of the world, where more of the population are older. I also have to point out that hospitalizations are a lagging indicator. It usually takes a week or 2 weeks after a surge to see the hospitalizations. But the data from South Africa is very hopeful, especially since they have already been dealing with the surge for at least a week or two. And the hospitalizations do not seem to be dramatically increasing po. Next slide, please. Based on this, I would like to suggest the following for preparations for the arrival of the Omicron variant in the Philippines. First, there is no need to panic. Let us celebrate Pasko. This is the best time in 20 months for the entire country. I am so proud to be a Filipino because I boast of this. Here in the United States, I say we have 500 cases po yesterday compared to 120,000. The positivity rate is less than 2%. This is some of the best numbers in the world. And so this is not the time to panic. It is the time to be careful. We have to prepare, but we also have to celebrate, especially since this is Christmas. We must prepare the hospital infrastructure and increase healthcare worker staffing capacity po, because over in the Alpha and Delta surges, it was